Hello, I'm Dr. Marla Shapiro. I'm the past president of the North American Menopause Society, and today I'm joined by someone well known to the NAMS family, Dr. Nanette Santoro. Nanette, for our healthcare practitioners, can you introduce yourself?
I'm Nanette Santoro. I'm professor and chair of OBGYN at the University of Colorado School of Medicine.
So one of the concepts that we're beginning to embrace and not necessarily know what we're embracing is this concept of wellness. So when you hear that, what is it we should be thinking about?
I think it can mean many things, and I would say if you asked 100 people, you would get 100 definitions, but there are some bodies that have worked on research in this area, and I think the most important aspects of it that they have brought to us are it's not merely the absence of illness. So we think if you don't have a disease that's either physical or emotional or psychological, that you are well, but that's not really the case. And we are learning that you need to have health in many aspects. Social connectedness is a form of health, and that leads to wellness. Without that, even in the absence of illness, you are not experiencing wellness. So you add to those things environmental health, and you have a much broader context in which to look at wellness. So it's really a positive state, a frame shift of not what I don't want to be, which can be considered based in fear, I'm afraid of this disease or that disease, but what I really want to be, what is my best life?
So when we look at perimenopausal and menopausal wellness, does that change with menopause?
I think what changes with menopause, and particularly with perimenopause, which we hear over and over again in clinical practice, is that women begin to lose that feeling of wellness that they may have taken for granted, begins to erode, and that begins to lead many of them on a quest to get it back. And I think that we can, as doctors, we can help bring them back and help point out what things will restore that sense of wellness.
So it's a much more holistic concept than for many healthcare practitioners who are very much disease-driven, or we like to think prevention-driven, but we're still thinking about prevention of diseases. You're talking about much more than a particular disease state.
That's true. And it's really taking a look at the whole person, which is, of course, holistic, and making sure that all of these areas are being attended to in a positive way, not in a negative way, not just to avoid disease, but to maintain health, what we call health span. So it's not just about lifespan. We doctors are a lot focused on, patching things up and getting people out the door, but this is really optimally patching them up and optimally preventing them needing patching.
So you talked about the concept of social connectedness, which is something that healthcare practitioners often don't address at all. And that role of social connectedness in terms of its role of wellness, why is that so important to us?
Well, loneliness is a killer, and it leads to heart disease, it leads to psychiatric problems, and further isolation. So we've learned very much in the COVID era with the global pandemic that social isolation is one of the most worrisome things that can happen to someone, that it's going to make them most vulnerable. And we've seen some real holes in our society as a result of the pandemic that have really led us to understand that we really are all connected, and we must keep that in mind. And doctors have to take that up because no one else is.
So when we think about how to best incorporate the notion of wellness for our patients, how do we introduce that concept into our practice and into our relationships with the women that we see?
I think there's a couple of categories of patients that we see, and there are some who really do come in frankly seeking wellness, and they can almost tell you that. I used to feel great, nothing bothered me, and now like this, and this seem to be taking that feeling away. Those women are pretty easy to get into the mindset of moving to a positive direction. And then there's another group of patients who really are just so symptomatic that they're more in a fear, what I would call a fear-based mode. They're afraid of what their symptoms are doing. And those are the patients I think we have the most potential to move into a positive, okay, these things are frightening you now. Let's try to address those, and let's look at the whole picture of you and where you're going, and see if we can change some of these risk factors that aren't pointing you in a good direction and get you pointed in that good direction.
So the notion of wellness, as I hear you talk about it, yes, is primary prevention and all the strategies that we want to put in place for our women to talk about wellness, heart health, bone health, you name it. But it's so much more in terms of moving our needle to think about emotional wellness, which seems critical, and how to incorporate that for our patients to understand that it's not just about our preventive strategies. It's about what you eat, how you think. How do we do that?
And I think it's partnering with the patient, so not just telling patients what to do, because we know that does not work. For example, in the case of weight management, you can keep repeating someone's BMI to them if it's high, and very little will change. Or they may change it, and then it's going to go back up. So if they don't get engaged or partnered, seeing a positive thing at the end, not just if you don't lose weight, you're going to get diabetes. It's if you can lose and maintain weight, you're looking forward to a healthy, long lifespan after this little blip on the screen that we call menopause.
So does wellness go hand in hand with education?
I think it has to, for many women. And sometimes you have to kind of re-educate, because there's a lot of sort of faux wellness stuff out there too. So let's not forget that.
So as a healthcare practitioner, teaching other healthcare practitioners, how would you best advise them to embrace that concept of wellness, but then be able to move it forward and bring it into their relationships with their patients?
I think at assessments, and again, I really feel like menopause and perimenopause are such ideal times to intervene, because women really are taking stock of their health, and they are willing, because they've had some kind of a symptom experience, almost everyone has, to make some changes. So we have such an opportunity to take advantage of that and point them in a direction and just say, these things are not serving you well. These habits that have been a problem for you are not serving you well. Let's try these modifications and see if you can move on. So for example, metabolic syndrome, trying to address that in a positive way with patients, and leading them to the absence of metabolic syndrome in a feed-forward loop that's virtuous, instead of the opposite, which is where they're going insulin resistance, weight gain, more insulin resistance, more weight gain. If we can help them roll some of those things back, that really begins to get them into a positive mode.
I think what you're talking about is a dramatic paradigm shift in our thinking as healthcare practitioners, that a lot of what we do are components of wellness, but it may not be wellness in terms of the best and greatest that we can offer as a complete care package.
Yes, I agree. I think we need to engage patients. And when again, the weight loss example is such a good one, because so many people are trying and not succeeding at losing weight. And it's very easy to just get discouraged, stop giving advice or motivation, but also getting at what is preventing that person from moving forward is really the way to bond. And if you can do that, that's a huge advantage, and that really begins to get patients into the holistic model.
It's a challenge, I think, for all of us as healthcare practitioners, but I think it's a welcome challenge for us, and I think something our patients would embrace.
I agree.
Well, thank you so much for joining us today.
You're welcome.